Okay, it's a few minutes past 11, so I think we'll get started. So again, good morning. My name is Mark Hand. I'm a director at Mobility Ways. Really pleased to be hosting this latest webinar, joined by Dr. Matt Sawyer. And I'll introduce Matt very shortly. Today's about the health benefits of zero carbon commuting. Certainly when I speak to many large employers around the country and we talk about the benefits of zero carbon commuting, I touch on things like parking management, obviously reducing emissions, in terms of reduced costs for staff, air quality, and so on. But also very much along that list is the health benefits of zero carbon commuting, whether in terms of air quality or what we're going to particularly focus on today, which is physical activity. So, as I say, joined by Dr. Matt Sawyer, who's going to do the presentation today. Matt's been a GP for more than 15 years. And is working on how to help primary care in terms of their aim of reaching net zero. He's a carbon literacy trainer, which is what we're covering in our next webinar, and also helps produce carbon footprints for practices. So with no further ado, I'll hand over to Matt, and the floor's all yours.
Absolutely wonderful. Thank you very much, Mark. And it is a joy and a pleasure to be with you all this morning. So I get to do my best Chris Whitty impression and say next slide, please, quite a few times. So you will get the t-shirt later on. So I'm Matt. I'm medical doctor, so I worked as a GP from the mid-noughties, which makes me sound like a toddler, mid-2000s up until last year. And now I really spend all of my time thinking, how can we make the world a better place and use environmental sustainability to improve things like staff well-being, staff morale, practice finances, company efficiency, and all the rest of it. And this is a picture of me doing a waste audit. It's very important, if you do a waste audit, get permission first. If not, you appear to be a stalker just going through other people's bins. But I'm not going to talk about waste today. I'm going to talk specifically about physical activity. Next slide, please. And first of all, I'd like to make the definition or the distinction rather between exercise and physical activity. Exercise, we often think, well, we need to get some special clothes or go to a special building to do this, whether it be a gym or a football pitch or whatever. And we can often see it as a sort of punishment or an atonement for our overindulgences. We've eaten those extra crisps or chocolate or drunk too much or whatever it is. I need to go and exercise to atone for my bad behaviour. And actually, physical activity doesn't need any of those things. Physical activity is about moving. It's about dancing, it's about gardening, it's about kneading bread, it's about doing all sorts of things that is just being physically active. And there's two things that particularly fall within that. One is active commuting, which is what I'm going to get onto a little bit later on. But I want to point out a standing desk. I'm at a standing desk right now. I do a number of online talks and presentations and training. And if I use my standing desk to deliver, I actually get in at least 250 steps every hour. And that's just by standing rather than sitting. So we don't have to go to special places to do these things, and a standing desk doesn't have to be anything more exciting than some boxes piled up on your desk with your computer on top of that. So if all of you who are listening at the moment would like to just listen whilst you're stood up, you will find that it makes a difference to your physical activity of the day. Next slide, please. And there's a whole host of benefits of physical activity, and it depends on how vigorous your activity is as to what sort of health benefits that you get. So, for example, we know that if you are doing just one episode, one bout of moderate to vigorous physical activity, you get better sleep. We can feel less anxious. We can reduce blood pressure. So we can actually feel better immediately after doing physical activity. Next slide or next click. But there are some more important longer term benefits. So being regularly physically active can have a whole host of important benefits on whether we are likely to develop a host of chronic diseases. Now, I suspect if I asked for a show of hands and said, which one of these would you like? Do you want to have dementia or depression or heart disease or diabetes or cancer or weight gain? Actually, you'd say, no, I don't really want any of those, thank you very much. None of them sound very appealing. So the question then is, well, what could I do to try and prevent some of these things? And physical activity is one of them. Very specifically, in terms of cancer prevention, the 8 cancers, just because people might say, well, what are those cancers? These are things like bladder cancer, breast cancer, colon cancer, endometrial cancer, esophageal, kidney, lung, or stomach cancers. I don't want any of those, thank you very much. So being physically active and being regularly physically active will lower my risk of them. And this is actually really, really important. Next slide, please. But it doesn't stop there. I feel that I'm one of these sort of salesmen now saying, and there's even more. So physical activity, we know that it reduces that depression and anxiety. Importantly, from a workplace and an organisation perspective, physical activity enhances thinking, learning, and judgment skills. And I'll come on to that a little bit more later on. We know it's really important whether you're young or old, but certainly in terms of healthy growth and development, it is really important for young school-aged and college-aged people. And it improves overall well-being. So actually we get not just a healthier workforce, but a happier workforce as well. Next slide, please. So I've made mention that there are these physical health benefits, in this case of walking, but of physical activity. So there's physical health benefits and there's mental health benefits, but there's a whole host of additional benefits as well. And you don't get these if you took a tablet or something to try and avoid Alzheimer's or diabetes. You wouldn't get these other benefits as well. So in terms of helping the local environment, we know that active commuting, walking, wheeling, cycling, means that there is not an impact on air pollution, that there's not a release of carbon dioxide or greenhouse gases as a result. We know that in this case, walking as part of the active commute can enhance the neighbourhood. So people are actually more engaged. They actually see their neighbours. They actually talk to people. They actually see things that they wouldn't have otherwise seen. So trees, they hear birds. There are all sorts of additional benefits of being out and doing physical activity within the neighbourhood, within the community in which we all live. Next slide, please. So physical activity on its own is really, really good. But what would happen if we did that outside? If we did that in the natural world? So it's not just about having a standing desk and walking around the office, but what would happen if we did some of this in nature, with trees, with plants, with flowers around us? Well, actually, just being outside reduces the incidence of things like diabetes and cardiovascular mortality, and reduces strokes and asthma and heart disease and all sorts of other things. So being outside is good for our health, and being physically active is good for our health. Well, why don't we do both of them at the same time? Next slide, please. So what would be the opposite? What happens? What is the impact of inactivity? Well, there's a huge financial cost of people being inactive. And certainly there was a calculation a couple of years back that suggested that this was about $6.5 billion. This was actually pre-COVID. I suspect that number will have risen, not just because of inflation, but because of we've seen the impact of physical activity on other parts of our health. In the workplace, physically inactive individuals lose nearly a week a year compared to active individuals. Now, this is in part through sickness, through in health, through absence, but it is also through being less efficient in the workplace. So I mentioned earlier on that one of the things that physical activity did was enhances thinking and learning and judgment. Well, actually, that is translated into a more efficient employee within the workplace. So how can we encourage, enable and infuse our staff, our colleagues, to become more physically active, because we know as an organisation that we're actually going to be getting a healthier workforce, but as a company, as an organisation, we're going to be getting almost an extra week's worth of work in terms of efficiency from them. 3 of the leading causes of long-term absence is actually related to physical inactivity. So we know we've got mental ill health, stress and musculoskeletal problems, and being physically active can lower the risks and alleviate the symptoms of those 3 conditions. So this is actually really, really important. There is a huge direct and indirect impact upon our workforce and on our productivity from being either active or conversely being inactive. Next slide, please. So this may be what somebody's workplace looks like. So what sort of things might we be able to do or to introduce when it comes to the workplace? Next slide, please. One of the most important things is how can a workplace enable, encourage and infuse more movement and more physical activity. So this is not about building on-site gyms, but I will come to that in a moment. It's about saying, how can we make it that we are not engineering physical activity out of our lives? One of the things that we often see is, the lifts are in front of you, the stairs are hidden or tucked away around the corner. Of course, it does depend on what the job role is, what the location is, and one size does not fit all. There is not going to be one single answer that everybody suddenly says, this is the thing that's going to make a difference, because it depends on you, your workplace and your staff. Next slide, please. One of the headlines that appears periodically in the press is sitting is as bad as smoking cigarettes. Okay, well, is that true? And if it is true, should employers be held liable? If an employer says, I am going to put you in a situation which I know is going to cause you harm, physical harm, should the employer be liable? So next slide, or next bit of this slide. Well, the answer is not quite. Sitting is not quite as bad as smoking cigarettes. Next bit of the slide. But if we sit for over 8 hours a day, so if we get behind our desk and do not move, actually we do start to double our risk of various conditions. It's not as big an increase as smoking does for some of the cardiovascular conditions and some of the cancers, but it is a problem. It is something which is important for us and employers and organisations to recognise. The question as to whether employers should be liable, that's something which is not answered at the moment. And so certainly other parts of across Europe, for example, are asking these sorts of questions, that if we need to protect our staff, our workforce from other risks, other harmful situations, should sitting be part of that? Next slide, please. So there's a whole host of important elements to this, and it's really thinking that being more physically active provides health benefits, and being physically active reduces the harmful impacts of sedentary behaviour. So there's a whole host of different things that we can do, we can think about. As I say, it very much depends on the role. So doing things like how can we bring movement back into our day? Well, how can we park further away if we're driving? How can we do it so that we are adding in extra steps each time we are going out and about? If we're on public transport, how can we make sure that we either get off earlier and walk the rest of the way, or we walk to the next stop before we even get on it? What about next time you do the shopping, for example, that instead of having a trolley, that you carry a basket? You're then engaging your muscles. Very, very simple change, but suddenly you're having to do something which is more like a mini workout. Of course, there's the obvious ones of taking the stairs rather than the lifts. Actually, you're getting your quads in your legs strengthened, for example. You're getting your heart rate up. I've mentioned about standing desks, but even if you don't have a standing desk, there's a whole host of ways you can set timers so that 10 to each hour you get up and make sure that you walk around the office. so that actually you're there trying to get some of the benefits of improving your circulation, reducing stiffness in your joints, getting your heart rate up. Each time you walk, you're actually telling your body how to balance better. It's things like when you brush your teeth, you do it standing on one leg. Sounds daft? They are all little bits of physical activity that start to make a difference. What about every time you take a telephone call, you do it walking? And certainly walking meetings for some. I've got a couple of great groups where we have walking meetings so that we are outside, away from the computer screen. Doesn't work for all meetings, of course, but where possible, and I'll come back to the where possible bit in a moment, how can we add it in? And it's really about how can we schedule activity breaks through the day. So it's making sure that when we are moving away from that sedentary desk-based behaviour, we're doing it with in terms of physical activity. Next slide, please. So what about getting to and from the workplace? This is really where physical activity can be built into a lot of our days, almost without knowing. Next slide, please. I suspect that most of us are already well aware of the travel hierarchy triangle, where introduced more recently is digital communication, but of course that doesn't necessarily mean inactivity, standing desks, walking meetings, etc. And it's how do we get more of the stuff up at the top, more walking and wheeling, more cycling. And there's been some great work looking at which are better for improving health. Is it a push bike or is it an electric bike? And the answer, surprising for some, was an electric bike. And people scratched their head and said, well, why? And it was basically because people used it. So having a push bike is great, but not so good if it just sits there in the shed or in the garage and doesn't actually get used. An electric bike, on the other hand, if it gets used, is far more effective because you're actually out and you're doing. Electric bikes are great because actually it allows people who don't think that they're fit enough, or who have got a disability of one sort or another, or my mother-in-law is 79, who wouldn't normally be able to manage a push bike, but could manage an electric bike as a result. So actually, these can be a real game changer. One of the things that I would highly recommend anybody who's not been on an electric bike doing is having a go. Have a trial, hire one for 5 minutes, go around the block. You will get this thing that is known as the e-bike smile. Suddenly you get off the bike going, that was fun, I like that. But if you never get to try it, it means that it's nobody ever gets that degree, that element of fun. So what would that mean for a workplace? Well, hire a bike, let everybody try it at lunchtime, have a go on it. It can make a real difference. So certainly from a physical activity perspective, we've got walking, wheeling and cycling. And from a carbon reduction perspective, we've got the digital communication, walking, wheeling and cycling. So personally, I don't mind why people walk more or cycle more, for example, if it's for your personal health benefits, if it's for the air quality of the neighbourhood, if it's financially because it's cheaper, or if it's because you want to reduce your carbon footprint. I don't mind. It's the same activity. You get all of the benefits all at the same time. Next slide, please. This is to represent that we do not have to do these things black and white. This is not binary. This is not 1 and 0. It is not an all or nothing. It is a shade of grey. And I believe that there was a book that was written called 50 Shades of Grey, which I haven't read, but I suspect was probably about a graduated response to physical activity in the workplace. As I say, I've not read it. But what it means is that you can say, I am going to walk when it's sunny. I'm only going to drive when it's 0 degrees or when it's freezing. I'm going to walk or I'm going to cycle the majority of the time, except when. So it doesn't have to be that you are a cyclist 365 days of the year. It could be that you say, I'm going to do it for 6 months. I'm going to do it from March to October. I'm only going to do it, or I'm going to do it when I walk the kids to school. I'm going to walk onto the workplace. Or I'm going to only go shopping once a week so that I'm going to walk or cycle to the workplace 4 days, and then on the 5th day, I'm going to go and do the shopping after work, so I'm going to take the car with me. And this is graduated. And this is really trying to say that you do not have to beat yourself up if there is a day where you say, actually, I'm not going to walk today. It's 3 degrees under, it's raining, there's ice everywhere, it's terrible, it's foul weather. So let yourself off. Don't beat yourself up and say, but I've failed. You have not failed. You do it 9 times out, you walk 9 times out of 10, that is a success in my book. Next slide, please. So actually, what does this mean in terms of a workplace? Well, one of the very important things that we can do is we can ask. We can talk to our staff. We can say, well, how do you travel at the moment? And how would you like to travel? What would be your preference? Imagine that the sun is shining. You don't have to take the kids to school. You don't have to do the shopping. How would you like to get to the workplace? And then it's for the organisation or the employer to work with the staff to say, well, what will enable that activity for you? Next slide, please. So this is from a survey that I did in healthcare, and we had replies from about 400 or so staff, and we divided them up into how far are they travelling at the moment, and asked, next slide please, how do you travel at the moment? So those that travelled between up to 5 miles a day, 70–80% of them either drove on their own. So this is how they do it at the moment. We then asked that subsequent question, well, how would you like to travel? It's a perfect day, the birds are singing, it is just glorious out there. What would you like? Next slide, please. And even those who had a round trip of up to 10 miles, the proportion of those who felt that they needed to get into a car fell substantially. And this was really quite surprising that actually people are not, on the whole, wanting to be in a car on their own. They're wanting to do something else, either be with other people in a car or on public transport on a bus, or walk or cycle or walking with other people. So we now know how people would like to travel. So the next question is, well, what sort of things are going to enable that? Next slide, please. And there's a whole host of different things that a workplace can do. And of course, it depends on what the factor that's stopping the employee at the moment. So the action then depends upon what's going to enable that employee. So it might be that it's a physical work thing. It may be that it's the surrounding road network, for example. So it's working with local authorities or cycle lanes. It might be actually within the workplace. Well, what is the leadership looking like? What is the ethos? What are the values? So there's a number of different things that an employer can put in place. So it's how does the management demonstrate its commitment to support the health and well-being of employees? What does the organisation have at the moment? What are the human resource policies that cover health and well-being? Is physical activity included within that? Is active commuting within that? What are the flexible hours? So that is there an opportunity so that people can walk, they can cycle, they can do physical activity at lunchtime or within groups in the workplace. There's a place not far from me who put on a yoga session for their staff at 6 o'clock when the place closes, and they were amazed at how many people wanted to stay and be physically active as part of a group. The amount of staff morale, improvement in staff morale and camaraderie as a result was phenomenal. What does the workplace do at the moment in terms of having a green travel plan? Is it able to design out that car dependency that we have at the moment so that we can actually increase the physical activity levels of the staff? Next slide, please. So there's a whole host of things that we can do, whether it be to enable or to promote physical activity and active travel, active commute. So cycle to work schemes being the obvious one, salary sacrifice so that we can get the bikes up front, and as far as I'm aware, e-bikes are included within that at the moment. Plotting out walking routes. how can somebody know the best walking or cycling route? And there's a number of apps and maps available to be able to do this. It's looking at that graduated response, this part active commute, so that I'm going to drive, I'm commuting 15 miles, I'm going to drive the first 10 and cycle the last 5. So it's not the whole commute, but it's not beating yourself up and saying, oh, but I've done some of it in a car. It's about looking at what works for that individual. And then, as I say, there's a whole host of enabling and making sure that we engineer physical activity into the working day. So whether it be walking meetings, lunchtime walks, standing desks, etc. Next slide, please. This is just a graphic that I've picked up from elsewhere, which just really, for me, demonstrates how frustrating car travel can be in terms of number of people who it's able to move. Now, you can tell that this is an American graphic because we don't tend to have transitways and sidewalks in the UK. But I use this to really demonstrate a company who I was involved with that was worried about the physical health of its staff. And they had basically an occupational health assessment of its staff, and they said they're really quite unfit. And this was for staff insurance. They said these people are at risk of developing health problems, so we need to put something in place as a company to make them physically more active. I know what we'll do. We'll build an on-site gym. Well, actually, that didn't really work. They built the on-site gym, didn't get used very much. And so they really started looking at, well, how can we get people being more physically active through the day? And the active commute was really the answer. They spoke to the staff and realised that the staff basically spent the best part of, well, between half an hour and an hour in nose-to-tail traffic, not going very far and not going very fast, every morning and every evening. And they worked out that it's actually far better to get them out of their cars and actually walking to work or cycling to work, which took the same amount of time, but certainly they had a more physically active and healthier workforce as a result. So the company's aim was to have a more active workforce, basically to bring down their insurance premiums. But we ended up being able to do this through physical activity and active travel and active commute rather than anything else. Next slide, please. This is my final slide. So for me, I think that there is a huge amount of workplace benefits and workplace rewards as a result of physical activity and active commute. So this is that reduction in absenteeism. So this is about people not being off sick as much if they're physically active. It's about that improved functioning in the workplace. And this is where those other days are, inverted commas, earned back by having a more physically active workforce, that they actually make better decisions. Physical activity improves motivation of employees, and this then has an effect on morale and working atmosphere. Can be a reduction in staff turnover. I suspect that most of us have had problems with staff leaving for a host of different reasons, and then having to have the whole recruitment process and training. So if there are things that we can do to reduce staff turnover, physical activity is one of them. And certainly from a public image, that if we are trying to attract the best staff that we can, having that physically active, healthy, looking after our workforce, looking after the health and well-being of our staff is really, really, really important. So for me, it's how can we get as much physical activity into as many people as possible, and making sure that we don't beat ourselves up or other people up, metaphorically, by having this only having a binary approach that you've got to do everything or nothing. For me, it's doing as much as you can whilst you're able. Last slide, and that's then me stopping and handing over for questions. So I'd like to say thank you all very much for listening. More than happy to talk about any and all of this for as long as possible.
Matt, thank you very much indeed. The more eagle-eyed amongst you will notice I am now standing. So I've listened and learned. And so thank you for those that have put questions in already. Please do use the Q&A, add some more questions in. I'm just going to spend 10 minutes covering some of the work that we do around postcode analysis of employees that can give an organisation a much better understanding of the potential for encouraging staff to be active in their commute. So please do add the questions then, and then we will have around 15 to 20 minutes Q&A to follow. Anything we can't then get through that's been directed to Matt, obviously send those questions off to Matt. And anything that comes through to me, obviously I'll come back to you as well. So if you bear with me 1 second while I grab the screen. Okay, fantastic. So listening carefully to what Matt was saying, I mean, some of the functionality that we have through Mobility Ways includes travel survey functionality. So actually going through that process of understanding what staff are currently doing, why they're doing it, what barriers exist in their minds for traveling more sustainably, and in this case, particularly actively, and what interventions we might introduce to improve that situation. We also include and have available personal travel plans, so we can actually show the individual specifically for their journeys what choices they've got. But what I wanted to focus on just for a few minutes is the postcode analysis that I think and hope you'll find quite interesting. Because what we're able to do is actually analyze postcode data to really understand what the art of the possible is for staff traveling to site for a given time. So it may be use of public transport and car sharing. It can also be obviously walking, cycling, or e-bikes or micro-mobility. And part of our thinking and the connection really about well-being here is around air quality. You may not know that 40,000 people die a year in this country, very sadly, because of poor air quality. And the cost to the NHS every year of addressing diseases caused by poor air quality is around £3 billion. So it's very significant. Now, what you can see on the screen at the moment is an aggregated report. So we can undertake this activity for single organisations. We can also work in the business park and environment, or where large employers are located quite close together. And in this case, we've aggregated the data. And what you can see on the screen at the moment is a bunch of postcodes. But these postcodes represent where staff are living, travelling to this point here. So if we actually hone in a little bit on the map, we can start to have a look at the potential in this instance for walking and cycling. And just to give you an understanding, around 39% of the 6,000 contacts that we analysed here lived within a 30-minute walk of site. Altogether, just under 60%, so heading towards 2/3 of all the staff that work for these various employers, live within a 30-minute cycle. This is not as the crow flies, this is on infrastructure. Now, we're fully aware, of course, that the geography around the country is quite different to Norfolk. We're blessed here in terms of cycling with quite flat areas, but you can change this setup and criteria from a 6-mile radius, for example, to a 4-mile or extend it to 8, depending on your circumstances. It's all very flexible. But what you'll also notice, apart from understanding the numbers of people that could walk or cycle within these distances, is where you have other groups and clusters of staff who live a bit further away, probably too far to cycle for many. But picking up earlier on Matt's point about e-bikes, and my mum's 94 and still using her e-bike, you can actually start to have conversations with clusters of staff in other areas to say, look, if we introduce an e-bike scheme, and you can do this through cycle to work schemes now as well, would you make use of it? How often, under what circumstances? What would you perceive to be the barriers? What would we need to do in the workplace to encourage you? And so you can really start to extend out active travel, because most of these people, when we do the travel surveys that go along with this analysis, we will find are currently driving alone to work in a petrol or diesel car. So the active bit, obviously very important. Just very briefly to show you that we can also hone in on public transport, and we can start to have a look at, based on duration, who we'd like to talk to and encourage to use public transport based on the options that are available to them. and also as part of the mix, and particularly in terms of improving air quality, taking cars off the road so it's more pleasurable and safe to cycle, then car sharing is an important part of the mix as well. And what you're seeing here with the green dots are postcodes where staff live, where they were within walking distance of at least 10 of their colleagues with whom they could share. And interestingly, having done this exercise now for more than 1 million postcodes across the UK, 80% of staff live in this pattern of within walking distance of at least 10 colleagues. So quite a lot of potential there to improve the attractiveness of walking and cycling and the air quality as well. Now, just going away from the mapping briefly and picking up on the report, and just one or two things here around active travel that I'm going to focus in on. One of the things we really hone in on is the benefits of active travel. So the walking and cycling, the calories that can be burnt off through basically where staff are living in this analysis, and also the percentage of staff that are fulfilling their NHS recommended exercise every day just through the commute, not through the gym having to expend out on a monthly fee. But also picking up on the point that was made by Matt, you're not going to want to do this every day. If we've got another storm coming crashing through, we had plenty earlier in the year, you're not necessarily going to want to walk or cycle. So what we can also understand, and it's part of the messaging that needs to go to staff, is that for all those people, in this case, the 39% of staff who could walk, well, all of them actually have a car share option in the event of really poor weather. And a very large percentage, 65%-ish, actually have public transport alternatives as well. Same for cycling. Big chunk of those that could cycle can also car share, and about 40% who have viable public transport options. So that's the gist of what I wanted to cover, just to give you a sense of the power of what we call Commute IQ as part of the Mobility Ways measurement service. So I'm going to stop there. Bear with me 1 second. Okay, and then just quickly to plug the next webinar that's coming up on the 16th of May, because this is a series of webinars that we're going to keep going right through the year in order to try and help improve understanding and knowledge and share knowledge around the issue of reducing emissions. So this is carbon literacy, the key to achieving your net zero targets. And the summary is that in the race towards achieving net zero emissions, understanding carbon literacy is crucial. This webinar is about illuminating the fundamental principles of carbon literacy and its pivotal role in navigating the complexities of achieving net zero goals. So it's the 16th of May. We've got some great speakers, Sophie Ellis from Mighty and from Lead with Sustainability, and our own Graham Bannister will be chairing. So please do sign up, 16th of May, 11 o'clock. Right, we're going to go to questions now. Let me just click on so I can see what's going on.
Can I just say that, so I'm a carbon literacy trainer. Carbon literacy is brilliant. I only do it for healthcare, so I wouldn't do it for anybody who's not healthcare, but there are people who are well trained, and the difference that it makes to companies and organizations and staff morale and staff commitment and green teams is awesome. So I know that one of the questions is about how do I educate and promote active travel? Well, if it's the how do I educate? Well, carbon literacy is there as part of it. And I don't know who the anonymous attendee is, but that is an amazing opportunity. So I would highly recommend listening to the next session.
Matt, do you want to just, because you've got access to the questions as well, do you want to make your way through the ones that are for your good self?
Yeah, no, absolutely. I'm not going to do them in the order. So one of them is how do we encourage staff to travel to work on bikes and walking when the weather's bad? Well, I think that actually both of us have probably answered that and said it's not an all or nothing. It's not you have to walk even though it's 57 degrees below freezing and you've got sort of to put the ring in the mountains of Mordor. Take a taxi that day. Take a bus. Find another opportunity, or do it on the days that you can do it. It doesn't have to be 100% of the time, and if it isn't 100% of the time, you've got to flagellate yourself with birch branches or something. Don't beat yourself up. Do it when you can. I'm going to put a couple of links into some of the answers. So, for example, somebody has asked about what does best practice look like for rural organisations with a distributed workforce in North Herefordshire with poor public transport and greater than a 10-mile commute to work? Well, certainly there are a whole host of options. We've heard from Mark about what could lift share look like, having an analysis. I put a link in to district nurses who are using e-bikes to get around. There's been a number of award-winning schemes that have really looked at e-bikes. E-bikes are revolutionary. Suddenly 10 miles is not that far on an e-bike. It feels like it would be a long way to walk, a long way on a push bike. Suddenly you find ways to manage this. Reward programs, there are a number. So one is, well, a number that I know of, and I suspect other people might know as well. There's one that I kind of quite like called Team Jump. They do a lot of behaviour change and behaviour change activities within the workforce. I've put a link to that in the chat as well.
Matt, just to add there, we're actually developing ourselves something called Commute Journal and Commute Boost. The principle is that we will be able to track all sustainable modes of travel. So whether you're walking, cycling, taking public transport, car sharing, and the reward for staff enabling us to track that through their phones is through what we call Commute Boost. So there could be a range of rewards that you thank people for giving access, but also for traveling in sustainable ways. So that is coming. Version 0, he says, is coming out early July. So watch this space.
Absolutely. There's a number of organisations who I think would have similar opportunities. I'm going to put another couple of links. So how can I educate my my staff? There's I'm going to give you a link to the government's Health Matters and Physical Activity. And basically it's a professional resource for it says local authorities and healthcare professionals, but actually it's accessible and available to far more. If people need to drive to work because they live too far away, how do we encourage them to be more active? Again, I think part commute, part drive, part cycle, part walk, part public transport commutes can make a difference. For some people, and there's a mention of delivery drivers and fleet managers. How can we get people to do more within the workplace? Within their working day. I think really we accept that, you know, there are some situations, some individuals, some job roles which are going to be sat down, sedentary driving. It's how can we look at the entire day? So, you know, it's how are people getting to work? What are they doing during their breaks? What are they doing during their lunch hour? Is there a way that they can make their activity more more physical as a result? You know, standing desks for sedentary people in a desk-based workplace. Obviously that doesn't apply if you are a delivery driver. So for me it's how can we think more creatively about all of those waking hours? You know, we've got 16 waking hours. How can we get that, you know, activity into each of the hours where possible? In terms of infographics and resources, there's another thing which I'm going to put in your link, which is has got some health benefits of physical activity. So hopefully everybody can see all of the answers, and that's got some great slides, images. It forms part of a bigger physical activity guide. Somebody's put in, what quick fixes do I have or are there to make people more active straight away rather than policy changes? I think some of it's about looking at what people are doing through the day at the moment and saying, what could we substitute? What could we switch? What could we change? You know, can we have those walking meetings, walking phone calls rather than sitting down ones? Can we have those standing desks? You put the standing desk in, you're physically active from that day. It's not that you've got to wait for 3 months or 6 months to put in a cycle shelter or something. You're doing it immediately. Looking at where staff live, where staff come from, what sort of travel options are available to them, you can put it in place the following day. It's not that you've got to wait and think, well, I could lift chair, I could part active commute, but I'm going to wait 6 months. You don't have to. You can do it immediately. I think one of the questions that's there, please jump in if you need to, if you want to, Mark. One of the questions is about commuting in a more physical way if they can't be bothered or just want to drive because it's easiest. Personally, I do not think that we can get 100% of people being physically active. I think that there are a whole host of reasons why they might not want to, and every so often I have this sort of slight cynicism that we as humans try and do the easiest, laziest thing, which is why we have so many time-saving devices, whether it be microwave ovens or ready meals or cars or whatever else it is. So we don't really like expending a lot of energy if we can avoid it. We've sort of got this, some people seem to have this sort of natural sedentary state. So you're right that there is inertia to overcome. So then the question might be, well, what are you interested in? What are you worried about? And it might be finances, it might be children's health, it might be all sorts of other things. And it's then saying, well, actually, if you're worried about finances, one way that we could improve your finances is reducing your travel expenditure by being more physically active. Or I'm worried about my kids' health. Well, if you're physically active walking to work, we can help use that to positively influence and model physically active behaviour, which will improve your children's health. So we can actually almost find the answer to every question being more physically active. So you don't necessarily need to come and say, right, let's all be physically active. You might do it through finances, you might do it through staff morale. So walking to work with somebody else or lift sharing is really, really good for staff morale. Well, that might be the reason that they do it, not because of physical health gains. It just happens that they're being physically healthier as well. Do you want me to keep going, Mark?
Well, I was just going to jump in on the one about working from home, and simply because I was at the workplace event in Birmingham yesterday, and getting people back to work was a major issue that was being discussed. So there's been a big survey done of staff and executives, and I thought I'd just share these percentages with you because I thought it was really interesting. So when asked, this is staff, how many of them would like to return to 5 days a week? And obviously there were certain sectors where you have no choice. But in terms of office environments, for example, the number of staff who wanted to return to work 5 days a week was 3%. The number of executives who wanted their staff to return 5 days a week was nearly 70%. But the number of staff who wanted a hybrid approach, so at least to be spending 2 days a week in the office, was 86%. So the majority by far wanted a hybrid approach. Now, from my perspective, in terms of sustainability, and Matt's, I'm sure, in terms of activity, when people are commuting to work, we want them to be sustainable and active. And that's the gist of it. So I don't think, again, it's graduation. It's not about we need to spend all our time at home and that's the solution. It will be a mix. But the main thing is that when you are commuting into work, you do it sustainably and wherever possible, actively as well.
Yeah, absolutely. I've answered another couple. So there's a number of different companies that do e-bike subscriptions. It depends on where you live as to which one might be most appropriate. So I'm in North Yorkshire. I go to York and they've got a fantastic, you can just hire e-bikes on the streets effectively. It depends on where you are as to whether that's possible. But so there are companies across the country who do e-bikes in different ways. So some you will hire a bike for 3 months, others will be a whole workplace. It depends on the option. I put one in the chat, but I don't recommend any one company. It depends on what fulfills your requirements best. One of the questions is, what recommendations do I have for people who work in business parks where walking and cycling may not be possible? Okay, well, I would turn that round and I would say two things. Firstly, what would make it possible? what is the enabler or enablers that would allow walking and cycling to take place? What's the barrier at the moment, and what can be done to overcome that? And secondly, so I live not that far from a business park industrial estate, and we get quite a lot of people who have basically found a walking loop that they do. And so we often see groups of 2, 3, 4, 5, 6 employees not quite following each other in a stalkerist kind of behavior, but sort of, you know, doing the loop and just chatting to other people. And so they get that combination of physical activity and being outside and connecting and chatting and gossiping with their colleagues, which they can't really do in the workplace.
I think sorry, go on.
No, go.
I was just going to say, I think it's a good example of some of the work we've done around the aggregated data. We did some work for a big logistics park in the Midlands for one of our clients, Prologis, and the data that we found achieved two main things really. One was about amending the public transport routes in to better align with where people lived and times of shifts. That made a massive difference. And the second thing was we identified just how many people could cycle, less so walking. And therefore there have been some alterations in terms of physical structure because that have been implemented to allow safe cycling. Because with this type of data, you can have conversations with your local authority because you have data to demonstrate the potential. So when they're looking at how to spend their next batch of funding from government around active travel infrastructure, why not think about your location, your business park, because you've demonstrated the potential. If you've also done the travel survey to say people would quite like to cycle, if it was safer to do so, then you've got perfect evidence base.
It's amazing what happens when you ask people and suddenly they give you all of the answers, and then you just take those answers and find the people who will enable the changes to happen, and suddenly you go, that was a lot easier than I thought. But yeah, talking to staff about, you know, what would enable them to do things different, and somebody has put exactly that you know, we cannot continue, you know, we need to think differently. You know, we do, you know, we know that what we're doing at the moment isn't necessarily good for us, for ourselves, for you know, for the planet, for physically, mentally, and all the rest of it. So you're absolutely right. We do need to think differently, and I think that this is one of the ways. And it's not waiting for some, you know, billionaire tech person to come along with a brand new solution. These are things that we can do now, today, this lunchtime. You know, Mark stood up an hour ago. You know, it didn't take sort of, you know, some genius to create something to do that. And Chris, absolutely, yeah, Hurricane is another bike company. There are a number of them. Certainly Hurricane and Volt, I think, from a health perspective, have both had trials within health settings. And I recognise a few of the names in the attendees. And for me, I would encourage, if there was a way from a health perspective, and I'm being a bit selfish here, to use some of the tools that Mobility Ways have got, such as that staff mapping effectively of what travel options there are available. Imagine if we did this at scale at every GP practice, every dental practice, every hospital, so that we have got answers and options for everybody that works there. And actually, this is where some of those changes, and where we think differently, so that we're not just accepting that we need a bigger car park and a bigger road and all of the problems that are associated with that. So that would be my plea to anybody in the audience who's ICS, ICB, PCN, initials which nobody else knows what they mean, but if you're one of them, you know what I'm talking about.
Have we covered everything off? Or we might have missed one or two. Someone's asked what percentage of people wanted to come 1 day a week. I don't know, I'm afraid. That was all the stats they had on the screen from the report. And then there's the issue of staff coming back in insufficient room. Yeah, there was a lot of conversation about that yesterday. Part of it to do with actual capacity in the office, and part of it to do with car parking capacity. And of course, if we can get people travelling more sustainably, car sharing or actively or on public transport, then you reduce the demand on the car park. So there was a part solution there, but you're right, we do need to think differently. Have we covered everything else?
There might be one about rewards for people who travel actively and sustainably. So talking from a healthcare perspective, I know that there are things such as, if you part commute or part active commute or whole active commute, that there are things like you get money off your coffee at lunchtime or your coffee break, or there are benefits for effectively not parking in the car park and being more active in term, or more sustainable in terms of how you've gotten to the workplace. And some of them have been really very successful indeed. So Manchester Trust, for example, I think 40% of their staff, the figures I last saw, 40% of their staff were traveling either actively or on public transport, which from a health setting, and if you imagine the shifts that are being done in a hospital, is really quite impressive.
Yeah, one of the other examples I remember is where people earned more time off, because we all value time probably more than anything else. Now, in some scenarios, nursing staff, for example, that may not work, but within administrative settings, that could absolutely work. And I think the key thing there, which is why we're developing the things we're developing, is to be able to prove that you have walked or cycled or taken public transport, and that's been lacking so far. So hopefully that's something we can help address, and then come up with ideas of more incentives that can be offered that aren't going to cost you a fortune as an employer.
And absolutely, and for me, it's looking at, there are something might have an upfront cost, but actually, if you're going to be getting an extra week's worth of productivity from your physically active staff, compared to physically inactive staff, I mean, that is quite a big incentive. And people might say, oh, but it's going to cost me £50 to put in this bike charger or bike rack or whatever it is, forgetting that actually a week for each employee that uses it, a week's extra productivity from each employee that uses it, is phenomenal. But we don't necessarily cost that at the moment. So it's knowing that that there are all of these hidden co-benefits of doing this, which means that you've got a happier, healthier workforce, better morale, and all the rest of it.
Brilliant. Right, I've just had my next meeting beep in. I'm sure that's happening all over the country for people listening to this webinar. So thank you all very much for joining us. Thank you, Matt, very much for your amazing expertise and knowledge. Do join us on the 16th of May for the next webinar. And thank you, a genuine thank you for joining us today. And enjoy the rest of your day.